Welcome back to this week's episode of Hormones, Metabolism, and You. I'm your host, Dr. Cassie Smith. I'm a functional endocrinologist based out of Oklahoma City. This week, I am interviewing Dr. Heather Finley. I'm so excited about this interview. We are talking all things gut health. So since my book is coming out this summer about gut health, I wanted to bring on a gut health specialist so I could answer all your questions about gut health. In this interview, we talked about the most common GI side effects that people struggle with. In particular, we talked about bloating, and we talked about why bloating is not random and what could be causing bloating, and particularly digestion issues, acid issues with your stomach, enzyme issues, mineral deficiencies, which was a very interesting conversation, motility issues, and stress. We also talked about gas, the different types of gas that you have, and why you have gas and ways to avoid gas. We then transitioned our conversation into constipation. That's a huge thing that people struggle with. We defined what is constipation, how often should we actually be having bowel movements, which is at least once a day. We talked about all the causes of constipation, and we talked about ways that you can fix this without medications like Miralax or Linzess or things like that. Dr. Heather gave a lot of tips on things that you can take to help with digestion and help with constipation. And we had this long conversation about minerals and why they are so important, and how people struggling with fatigue and having food cravings and bloating, how minerals could actually help that, and what minerals are best for this. We talked about all sorts of testing that you can do with your gut. And if you can't find a provider or afford the testing, just some natural remedy things that you can do at home. She actually gave a tip of a 100% free test that you can do at home to tell if you have bloating issues. All it requires is water and baking soda. So I have to listen to the episode for that, but I thought it was very interesting. So in this episode, I interview Dr. Heather Finley. She's a registered dietitian with a doctorate in clinical nutrition. She and her team help people struggling with bloating, brain fog, hormone imbalances, and GI issues finding lasting relief and feel excited about food again. After battling her own digestive and hormone issues for nearly 20 years, Heather understands firsthand how nutrition, lifestyle, and mindset influence gut health. She believes gut healing shouldn't be restrictive, stressful, or all-consuming. Her signature approach helps individuals reduce digestive symptoms while expanding their diet. Dr. Heather earned her doctorate in clinical nutrition from Maryland University of Integrative Health. Her expertise has been featured on Good Morning Texas, Mind Body Green, Yahoo Life, and Very Well Health. She's the founder of the Gut Together program for individuals and the Gut Practitioner program for clinicians. She also wrote a book a few years ago as well, which was a cookbook, and we're going to talk about that, and we'll link all of it in the show notes. So stay tuned for this exciting episode. Welcome back to this week's episode of Hormones, Metabolism, and You. Today I am interviewing Dr. Heather Finley. She is a doctor of nutrition, and she talks a lot about gut health. So if you guys don't follow her on social media, I'm going to let her tell you how you can do that. But I'm very intrigued by her work because she talks a lot about the symptoms that all my patients have when we talk about gut health. And with my gut health book coming out, I wanted her to come on and talk to you guys about all the things you messaged me about. So we're going to talk about bloating, and we're going to talk about gas, and we're going to talk about minerals and constipation. So thank you for coming on and helping educate our listeners.
Thanks for having me. So excited to be here.
So can you tell everyone just kind of briefly, I guess, how you got into gut health, why you do what you do?
Absolutely. So, like many health providers, I got in because of my own GI issues. And to make a very long story short, I struggled with lots of bloating and chronic constipation for probably 20 years of my life. Spent so much time cutting out foods, trying all the trendy elimination diets, trying to figure out what was actually going to relieve my symptoms. Ended up going to school to study nutrition, thinking that that would finally be where I could fix myself. And unfortunately, I left school, my undergrad, and felt more confused than ever. I was feeling worse than I ever had, and also felt a lot of imposter syndrome about how could I ever help a patient. I just spent 4 years in school studying nutrition. How am I ever going to help somebody else feel better if I can't even help myself? And so, started my first job working in a hospital as a clinical dietitian, was working with really sick patients like oncology patients and on the renal floor, and did a lot of soul searching at that time, trying to figure out, am I even in the right field? What am I doing? And that's when I was introduced to more of a functional approach to nutrition. I had a friend who was going through some similar things, started talking to me about some of the stuff she was doing, and I started wondering why I had never learned about any of that in school. And so started down this rabbit hole of functional nutrition and integrate a more of an integrative approach. And that's when I really discovered that everything is connected and that a lot of the symptoms that I was having, of course, might have been nutrition related, but that it was actually a lot deeper than that. And that the chronic GI issues that I was having, which then turned into Hashimoto's and hypothyroidism, were very much there was a lot at the root that had more to do with the minerals in my body, how I was digesting food, my gut motility, the bacteria in my gut, all of that. And once I actually was able to address that and develop a lifestyle that supported that from a stress standpoint, a sleep standpoint, blood sugar balance, all the things that you talk about, I was able to feel a lot better. And so now I get to help other women struggling with the same thing do the same, and find relief, even though they've tried so many different things, so many elimination diets and medications and all the stuff. So here we are.
Yeah, I love that. So, and I also saw on your Instagram page how now you even like eat dairy sometimes and you drink wine and all these things when you had all these gut issues. So, yeah, so like most providers, you have kind of a story where you didn't feel well and you couldn't find the right answers. So you kind of took things into your own hands and figured it out, which I love. So I think I want to start with bloating because you did a post recently about bloating and you were talking about how it's not necessarily always the food that you're eating, but maybe more paying attention to the timing. Because to your point, there's a lot of people by the time they come to me, they come to you, they've cut out dairy, they've cut out gluten, they're still bloating. And bloating, and I'm going to let you explain this, but you can be bloated in the morning, you can be bloated before you go to bed, you can be bloated after you drink water. There's different times that you're bloated that sometimes mean different things, but let's just talk about bloating in general. What's the most common, I guess, presentation of bloating that you get? And then tell us some of the reasons why people are bloated and things we can do to treat that.
Yeah, so there can be a lot of different causes of bloating, but I would say the most common presentation of bloat that we see in our practice is typically I get progressively more bloated throughout the day, and by the end of the day, I feel 6 months pregnant, even though I'm not pregnant. Where we even have clients that come to us that have their morning pants and their afternoon pants because their bloating is so severe that they have to change pants at the end of the day because they're so uncomfortable. Of course, we do get clients that wake up bloated and they're like, I never have any relief. We get clients that say, I get bloated an hour or two after eating. And all of those are going to have different causes, which I'm happy to go into if that would be helpful. But sometimes, it's very easy to think, what did I eat that made me bloated? And of course, there are foods that are going to make you bloated. If you eat a whole plate of broccoli or a whole plate of cauliflower, I would expect you to be bloated. Even if you drink some sparkling water, it's not abnormal to get a little bit bloated from that. But if you are chronically bloated every time you eat, you're waking up bloated, you're bloating after a meal, you're feeling 6 months pregnant by the end of the day, that typically is a much deeper issue than food. It has a lot more to do with how your body is processing the food versus the food itself, if that makes sense. So, yeah, like I said, happy to go into the different causes if that would be helpful. I would say most of the time, yes. Of course, there are things like even coordination of the abdominal muscles that can affect bloating. We see this a lot with clients that have pelvic floor issues. Or sometimes what our clients will say is, yeah, I bloat really bad after exercise. That typically is a sign that there is some sort of discoordination with the muscles in their abdomen. Can be related to pelvic floor as well, but a lot of times it is digestive related. We need to look at things like stomach acid, pancreatic enzymes, gut motility, bacteria in the gut. And when we can actually fix those things, the bloating gets a lot better.
Yeah, I completely agree. Digestion is huge. And, I've kind of gotten into recently, Ayurveda medicine and like body types and eating. And I'm somebody who, I'm just very acidic. And so I started incorporating green juice in the morning and like trying to become more alkaline in the morning. And that's helped my digestion a ton. So I truly believe in digestion and bitters and things like that. Can you explain to people how they would, so like let's say somebody that's listening is having these symptoms, like they wake up and they're wearing their pants and then they have to put on different pants later in the day. What would you recommend as far as testing? What would you recommend as far as like, let's say that they can't find a provider to do testing? Are there things that they can do to start helping their digestion?
Absolutely. So, with bloating, I would say the top two, well, three tests that might be helpful for you. Number one, a GI map is probably going to be your best bang for your buck as far as identifying what's going on. That's going to give us a lot of information about how you're digesting food, inflammation in your gut, the balance of bacteria in your gut, both quote unquote good and bad, different infections, parasites, candida, fungus, all of that. So that's going to be a really good use of just data to look at all the pieces of the puzzle. We also could throw in something like an HTMA, which is a mineral test. That is really helpful, especially for our clients that are bloating due to chronic constipation. We have clients that come to us that are taking 1,200 milligrams of constipation of magnesium, and they're like, "Why am I still constipated?" And oftentimes it has to do more with the balance of minerals versus like that they just need to take more magnesium. So we want to look at things like potassium and boron and sodium. And so an HTMA test can be extremely beneficial. The other test that I could kind of go either way on would be a SIBO test. If somebody has SIBO or small intestinal bacterial overgrowth, that's definitely going to cause bloating. But a lot of times with SIBO testing, it's very hard to get an actual accurate test because of the prep, the diet that you have to follow, the actual like execution of the test. And at the end of the day, SIBO is not a root cause. It's just a symptom of a bigger root cause. So if you're deciding between tests, I think your money is better spent doing something like a GI map that's going to tell you more about your root causes versus going through all of the breath test stuff and then wondering, well, now, okay, cool, I have SIBO, what's actually causing it? So those would be the three. Of course, kind of in your realm, we could throw in things like a thyroid panel to look at, like, is slow gut motility causing constipation because of thyroid issues, etc. But those would be at least a good starting place.
And so you said HTMA.
Uh-huh.
So is that a blood test?
Good question. So, no, it's actually a hair test, which seems kind of weird. Like, why would you test your minerals through your hair? But the HTMA is looking at a little bit different of a lens than blood work is. So, your blood work is showing here's what's going on in your blood at this moment. Here's what your iron level is right now. Here's what your calcium level is right now. Versus the hair tissue test is looking at what do your mineral stores look like over the last 3-ish months time period? And the reason that that can be really helpful is because a lot of times our body is really good at pulling minerals into the blood to keep those levels pretty tightly regulated. If something is off in the blood, it's probably been off for quite some time. We can actually predict patterns way before they ever happen in the blood through the hair and through the tissues. And so looking at it through a hair tissue mineral analysis will give us a lot more comprehensive view about your mineral stores, kind of the whole mineral symphony, being able to look at how all the minerals are interacting with each other versus just one point in time. It also will help you look at things like heavy metals, etc. And so it can be really comprehensive. And I mean, obviously, cutting your hair is not great, but it's a very small amount. It's not traumatic, I promise. And I think easier than getting a blood draw. So it can be an easy test you can do at home. Obviously, have somebody help you cut your hair. And send it to a lab. And then one test that I want to mention that's free that you could do if you're looking at, do I have stomach acid issues that are impacting my bloating or digestion, is you could do something called the baking soda test. This is not a diagnostic test, but it is something that you can do at home. Basically, what you'll do is you'll put like a quarter teaspoon of baking soda in water first thing in the morning, drink it, that solution, and see if you burp. And if you burp within 3 minutes, you passed. If you burp within 3 to 5, you like kind of passed. And if you don't burp, which is really common, it can indicate that potentially you might have low stomach acid. And low stomach acid is definitely one of the bigger root causes that we see for bloating and poor digestion.
So when you say low stomach acid, do you mean it's not as low as it's supposed to be? Like it's higher than it's supposed to be? It's not.
No, meaning that it actually is low. Yeah, so that
It's
it's
too low.
yes, too low.
Okay.
A lot of
Too low.
times people think that they have too much stomach acid, even in cases with like acid reflux. But the reality is that their stomach acid is actually not acidic enough. Your stomach should be as acidic as battery acid. We want to be able to kill off, it's like your first line of defense. So anytime we swallow bacteria or a parasite or anything, we want our stomach acid to kill that off so that infections don't get in our body. But a lot of people struggle with low stomach acid. That can be a big trigger for other things downstream when it comes to digestion.
Yeah. So you got to make sure your stomach acid is acidic enough to kill what you're eating or digest your food. So you said you put a quarter of a teaspoon in how much water?
Just like a quarter cup of water.
Quarter cup of water.
Yeah.
And then you just drink it. And then you should burp within 3 minutes. And if you don't burp in 3 minutes, then that's bad. If you don't burp, definitely within 5 minutes, it's bad. But you should burp within 3.
Yeah.
Interesting.
So then you can start looking at, okay, do I need to use something like, you mentioned bitters earlier. Do I need to use something like digestive bitters? What's causing my low stomach acid? Infections like H. pylori can cause low stomach acid. Do I have mineral issues? We need sodium, we need potassium, we need zinc, we need all of those things to make stomach acid. So then you can really get into the weeds and looking at how do we actually improve stomach acid so we can improve our digestion.
So if somebody, does this baking soda test at home and they don't pass, so they don't burp, and they don't really have the money to do a GI map or do this mineral test, then would your first go-to be, let's start some like digestive bitters? Would it be, let's start some electrolytes? And if so, what do you use? Like, do you use Relight? How often should you take it? Like, what would be your thoughts with that?
Yeah. Digestive bitters, I think, can help so many people. They are one of the most amazing tools when it comes to digestive health, and they're decently affordable. You also can just start eating a lot more bitter foods. You mentioned green juice, but even things like just arugula, like a handful of arugula before you eat, that bitter is going to help to stimulate digestion. Maybe not as potent as taking a product like digestive bitters, but it's still doing the same thing. So bitter, like radishes, even dark chocolate is a bitter. So getting more bitter foods just in your diet can be really helpful for stimulating stomach acid and stimulating that entire digestive process, and a great place to start. As far as minerals are concerned, Relight is a great product. It is a bit higher in sodium and maybe not the best for everybody, although we do tend to see quite a bit of low sodium on hair mineral tests. But if you want something that's just a little bit more balanced across the board, there is a product called Adrenal Cocktail that has sodium, potassium, and whole food vitamin C. That's a really great product. It's not as tasty as Relight or Element or any of those. Obviously, you can add things to it to make it tastier, but that is a great just overall mineral support. And the reason that we like that is because of the whole food vitamin C to support adrenals and the stress response, the potassium to help support thyroid function, and stomach acid, and then, of course, the sodium as well.
So if you're going to drink one of these things like the adrenal cocktail or Relight, is this a once a day thing? Do you just put it in water? Are you better off to mix it with something else? Like, how would you take it?
Everyone's going to be a little different, which I know that's like the most annoying answer ever, but I would say on average, doing it 1 to 2 times a day can be really helpful. We find a lot of our clients that are kind of hitting that like low energy afternoon slump find that like doing it in the morning to help just wake up and just kind of get out of a dehydrated state from sleeping can be really helpful. And then doing it again in the afternoon when you typically would want to reach for another cup of coffee or something to boost your energy in the afternoon. A mineral mocktail, something like adrenal cocktail or a homemade mocktail, could be really helpful at just supporting overall energy. So yeah, 1 to 2 times a day. And, if you're trying to decide on what time of day, you could always try to do it at the time of day when you typically feel the least amount of energy, to just give yourself a little bit of a boost.
Okay. And then going back to the hair test really quickly, because I know many people are thinking this, how much hair do you really have to cut? And is it like from the actual base or can you get some from further down? Like how much are we talking here?
So it's a teaspoon of hair. It's not very much. It
A
will
teaspoon?
look like more when you cut it than it actually is because you do have to cut your hair as close to the scalp as possible. Reason being is because we want the fresh hair growth because that's what's going to show the most recent mineral stores. So we always recommend having somebody help you with this. Have a partner, spouse, friend, hairdresser, whoever cut your hair for you. But yeah, you'll just pull back, a little piece of your hair, cut as close to the scalp, and you're going to keep like an inch, and then discard the rest. So it will, especially somebody like you who has really long hair, it will look like you're discarding a lot of hair in the trash and you'll want to panic, but it really is not that much. And you can do it from multiple sites on your head to get the amount of hair that you need. So it really is just tiny amounts at a time. Like I actually did it on my husband last night. Obviously, most men have shorter hair, and you can't even tell that I cut his hair. So you would think it'd be more noticeable on a male who has short hair, and you really can't tell at all. So
Yeah. I actually did it in 2023, I think, in the back of my head, but I was like freaking out. But yeah, it does look like a lot because when you have long hair, you're like, oh my gosh. But okay,
yeah, when you're throwing that in the trash, you're like, oh my gosh.
this is so bad.
Just don't look.
Yeah, just don't look. But I do like your tip. A lot of people will tell you after lunch they get really tired, or, for me, it's like I go home and eat dinner and then it's like I want to eat chocolate or peanut butter or something like that. And so my nutritionist, she's like, have some electrolytes. And so I've been doing that and it has helped. Like it does help you kind of like, oh, because some days we don't drink as much water as we should. And I think people forget too, like when you exercise, like I exercise every morning, I get in saunas. When you sweat, you don't just sweat water, you sweat other electrolytes. And so you have to replace those. So I think those are all really good points. And so I know you kind of touched on digestion and acid in your stomach and the minerals, but you also kind of talk a lot about motility and gut lining repair and like nervous system issues with bloating. And I think that's really important to kind of talk about the nervous system. So I was one of those people who was very guilty of setting down and like scarfing down my food in between, unloading the dishwasher and typing on my computer and doing 5 other things. And then I actually had a nutritionist, mine, who sat down and was like, Cassie, you have to be in a parasympathetic state to digest your food. Like you can't be, chasing a lion. And that made a lot of sense to me, right? So I think that's important to point out to people. Can you explain to people what the connection between your nervous system and bloating or just digestion is in general?
Yeah. So you hit the nail on the head. Your body doesn't know the difference between actually being chased by a tiger or rushing through a meal because you're stressed and you need to move on to the next thing. Stress is stress to the body. So anytime we sit down, and even if we have thoughts like, this is going to make me bloated or whatever, any kind of stress response, our body is automatically saying, I don't need blood flow in my gut. I need blood flow in my muscles so that I can run away from this tiger. So if you see food as a threat, or you see this meeting that you're about to get on as a threat, or you're watching true crime while you're eating and it's stressing you out, whatever it is, it's a stressor on the body. And so we want to try to relax before eating as much as possible and get into that rest and digest state, because digestion works when we're in a rest and digest state. So that could be simple and easy. Taking 3 deep breaths before you eat your meal. We always tell clients, like, hum happy birthday twice. That's going to stimulate your vagus nerve. That helps with gut motility, or the contraction of your gut muscles. It's going to get you into that rest and digest state. So there's a lot of different things that you can do to aid that process. And nobody's perfect, myself included. I definitely rush through meals still sometimes, but you'll notice a huge difference. And it's really easy to glaze over those like lifestyle tips, but those can actually really, really make a big difference when it comes to digestion. You really can't out supplement poor eating habits or a stressed lifestyle.
Yeah, I think that's really important. Okay, so then bloating. So that I would agree that's the main thing that people complain about. And for the most part, it is I wake up with a flat stomach and then I look like I'm 6 months pregnant. And so, if you are somebody who's listening to that and that's you, then what I'm hearing is you need to check your lifestyle. Like, are we eating while we're driving to work, doing a million things? Are we eating in a relaxed, sympathetic state? Are we chewing, or parasympathetic state? Are we chewing our food enough? Those type of things. And then if not, we've given you some simple tips, some ways that you can kind of help to start. Do you have a specific digestive bitter that you particularly like, or anything that you can find on Amazon? What are your thoughts on that?
Yeah, there's a couple that I love. Urban Moonshine is probably the most popular brand. You can get that one on Amazon. They were out of stock for the longest time, but they're back in stock now. They have a original and they also have a citrus. So if the bitter flavor is really hard for you, start with the citrus. The reason that bitters are bitter is because that's how they work. So although you can take capsules of bitters, it's not going to have the same effect because it's the bitterness that actually stimulates salivation. And that salivation stimulation is what stimulates then stomach acid production and pancreatic enzyme output, release, bile flow, all of that. So if you're having a hard time with it, know that you get used to it. It is bitter. They're not necessarily meant to taste good, but the citrus ones are great as a starting place, and you can get those on Amazon. Another brand that I love is Earthly. Those aren't, I don't think, on Amazon, but there's a lot of the Bitter X is another brand. Dr. Shades. It's a little more expensive because they're liposomal bitters, but typically our recommendation is the Urban Moonshine ones because they're easy to get and a bit more affordable.
Okay. So then let's move on to gas. So let's talk about gas. A lot of people have issues with gas. Is this the same as bloating, or are there actual foods that cause gas, more likely to cause gas?
So it can be. So sometimes people are gassy because a lot of times when you're bloated, it is gas buildup in your stomach. There's different types of gas. You can have methane gas, you can have hydrogen gas, you can have hydrogen sulfide gas. Hydrogen sulfide gas is what a lot of people will kind of call the like rotten egg smelling gas. But you can be gassy from what you ate. It is normal to be gassy after you eat a bunch of beans or eat a bunch of broccoli or cauliflower. There's, of course, enzymes and things that you can take to improve that, but that is just kind of a natural response to some of those foods. But sometimes the gas is a bit deeper than just what you're eating. It can be different imbalances in bacteria in your gut. If you have a lot of methane producing bacteria, that's going to produce gas and make you pretty uncomfortable. If there's no way for that gas to get out, it's going to lead to more distension and more bloating. Sometimes you can be gassy because you're swallowing too much air. Maybe you're eating too fast, drinking really fast through straws. That can cause gas buildup. So sometimes the fix is really simple, and sometimes, it's a bit more involved related to how you're digesting food or the bacteria in your gut.
So if you are somebody who eats a lot of broccoli or Brussels sprouts and you do get gassy, should that gas be, does it smell like you said, I think eggs, or it's just you have gas?
It might smell a little bit, but it shouldn't be foul. Like it shouldn't be like where you have to leave the room. It is normal to pass gas. I can't remember what a number is. It's like actually more than you would think, like the amount of times the average person passes gas every day. So it shouldn't clear the room at all.
So then if somebody is having issues with a lot of gas, is there a test that they should do, or what are some things that they should do to kind of help with that? And how do they know, how do they know if it's how they're eating versus what they're eating?
The first thing that I would really rule out with gas is making sure that you're not constipated. If you're really constipated and you have trapped gas, it's going to be smellier, and it's going to be more painful because you're going to be distended and it's going to feel like you have a bunch of gas that you can't get out. So I would make sure that you're not constipated and fix that. And then as far as how to rule out what it is, if you're gassy constantly, then it's likely not just what you're eating. Whereas, like, if you're gassy sometimes, it's probably more related to something that you ate or the environment in which you ate or just something that was a little off. But if it's a consistent thing every single time you're eating or most times that you're eating, then I would say it's time to look at perhaps what else is going on. It could even just be pancreatic enzyme related, like perhaps you don't have enough enzymes to help break down your food, especially like carbohydrates and fats. And so that could be a piece of the puzzle.
Yeah. So I would say then if you're somebody who's struggling with gas, again, look at your lifestyle, right? Like how fast are you eating your food? Are you drinking out of straws a lot? To your point, is it happening a lot? And then I see this a lot. I don't know about you, but I see a ton of people who have had their gallbladders removed and no one's talked to them about, any sort of ox bile or any sort of gallbladder support for fat digestion. And then, they're eating sometimes not the best meals and having severe diarrhea, but then they also have a lot of gas issues. And I'm like, well, that makes sense because you're eating something your body can't digest, right? Which is fat. So that's something, that's pretty easy to take care of. So if you're listening to this and you don't have a gallbladder and you do struggle with diarrhea or a lot of gas, that's something I tell people, is I get them on a good, we have one called the dissolver, but something with some ox bile in it that will help you at least digest the fat that you're eating. And to your point, pancreatic enzymes, I think, are very helpful as well.
Yeah, it's really common. We see that too, where clients have gotten their gallbladders out and they've been told, nope, you don't need to change anything about your diet or anything. And then years later, they're like, why do I have SIBO? Why do I have all this gas? It's like the snowball effect of not being advised correctly. That's really sad. And so, yes, the gallbladder is a huge piece, and bile is kind of the MVP of digestion, when it comes down to the fact that it's antimicrobial, helps break down fats. And so, yes, that can be a huge missing piece.
I completely agree. You need your gallbladder, people, if you can keep it. It's very important.
Keep it. Don't,
Yes.
don't let them take it out.
Correct. Same thing with your thyroid. Okay, so then that's a great segue into constipation, which is something I wanted to ask you about as well. So let's start with how many times a day should people have a bowel movement?
I would say 1 to 3 times is ideal. One is not better than three. Three is not better than one. The biggest question that you want to ask yourself is, are you completely emptying your bowels? So you might be able to efficiently empty your bowels 1 time a day. You go to the bathroom, you feel relieved, there's nothing left. Great. For other people, it might take a little bit longer. It might take 3 times. That can sometimes signify potentially a motility issue, but sometimes that's just how people's bowels work. I wouldn't necessarily make an issue of it if it's not causing problems. Uh, but you at least need to be clearing your bowels once a day, ideally. Anybody who tells you you don't have to go to the bathroom every day, I think that that is so incorrect. You eat every day, you should go to the bathroom every day.
I completely agree. So at least once a day, you heard it from her as well. So then tell me if you're somebody who doesn't go to the bathroom once a day. And, I have patients who say, I go once a week, and I'm like, oh my God, so bad. And let's assume that you've seen somebody like me and your thyroid's working and, you don't have a hormonal issue that's causing this. Then where do you go with people that struggle with severe constipation? Like, do you go mineral route? Do you go food allergy route? Do you go hydration? Like, what are you thinking with these people?
So, the first step usually is minerals with really severe constipation, at least for our clients, because most of the time they come to us and they've tried a lot of things. They've tried high doses of magnesium, they've tried Miralax, they've tried Linzess, all the things. Insert medication or supplement here, they've tried it. And so, like I was saying earlier, especially if it's the person that's tried 1,200 milligrams of magnesium citrate and they're like, I was still pooping rabbit pebbles. I definitely want to look at, okay, number one, are you drinking enough water? Are you getting like 80 to 100 ounces of water? And then if they are you getting enough fiber in your diet? That can be a big piece. Of course, tolerance to fiber comes into play there if they can actually break it down and tolerate it. But if those two things are really ruled out, then we want to look at minerals and see what's going on. Some of the common patterns that we will see on mineral testing is huge magnesium losses, meaning someone's body is just using a ton of magnesium and not getting enough. We'll see low potassium. Potassium is really helpful for the contraction of gut muscles. Your gut is a muscle, just like any other muscle in your body. So if it can't contract, then it's going to lead to constipation. We also will see low sodium. So that's where you get like the really pebbly, hard stool. I often describe your cells as like we want them to be plump grapes, not shriveled up raisins. So we need things like sodium to help hydrate our cells. So you could be drinking tons of water, but if you're just peeing it out and you're not absorbing it, then that can definitely lead to constipation. And then the last thing that we often see is calcium shells or calcium levels that are way too high in the tissue, contributing to constipation. And so we want to do what we can to make sure that calcium is where it needs to be in the bones and in the teeth, not in the tissues, preventing. I kind of describe a calcium shell like it's the time of year right now. You know those Cadbury eggs that are like the hard candy coating and then they have the chocolate on the inside? If there's a shell of calcium around your cell, it prevents all the other minerals from getting in. So things like sodium and magnesium. So we don't want high levels of calcium in the tissues preventing the other minerals from getting in. And we want to mobilize that calcium elsewhere because that calcium can lead to really, really severe constipation, even things like anxiety, etc., stiffness, joint pain.
Why would somebody have calcium around their cells?
That can happen for a lot of reasons. Oftentimes it's mineral driven. We'll see issues with like vitamin K. We need more vitamin E, other things that mobilize the calcium. Stress can cause that. There's many different processes, but minerals are like a symphony. So they're all going to sound weird if something's off. And that calcium can easily get in the wrong place. Sometimes it can just be from supplementing too much. Everybody thinks, oh, I want to prevent osteoporosis. I'm going to take a calcium pill. And not everybody needs that.
Okay, perfect. So then as far as the constipation, so have you seen people who have severe constipation that have tried milk of magnesium and linzest and magnesium and everything under the sun, who have added minerals and have, worked with you and been able to have normal bowel movements without taking medication.
Oh, yeah, all the time. Yeah, it's pretty incredible. Minerals are very underrated when it comes to metabolism, energy, constipation, etc. The thing that I love the most about minerals is when you can get minerals on board, typically you can get somebody feeling better really quickly, because it's like all of a sudden their cells, it like turns the lights back on. It's like the spark plugs of all the energy systems in the body. So yeah, I mean, it can be a huge game changer. Obviously, for some, there's other pieces involved, but really getting minerals on board is going to help somebody to respond better to a gut protocol, anyways. So we typically start there.
Okay. And then, so we've got the constipation hopefully fixed and addressed. Tell me about SIBO and leaky gut briefly. So this is kind of what's floating around, right? Like people talk about SIBO, they talk about leaky gut. What is can you explain what SIBO is and then how you recommend treating it? Because there's a lot of differing opinions, I guess, on that, I'll say.
There's lots of differing opinions, that's for sure. So, SIBO is small intestinal bacterial overgrowth. So, in case this is potentially new information, we have trillions of bacteria in our gut and on our body. A lot of those bacteria are housed in the large intestine or the colon. A tiny amount are in the small intestine. It's not completely sterile, but what happens is sometimes bacteria get where they're not supposed to be in the small intestine and they overgrow and they produce gases like I was talking about earlier. So either hydrogen, methane, or hydrogen sulfide, and can cause a lot of symptoms. Where I see people go wrong oftentimes with SIBO is that they just treat the SIBO. They think, well, I have SIBO, I'm going to take Flagyl, or I'm going to take Xifaxan or whatever, and then I'm going to be better. And the sad part is that a lot of times people do feel better for a short term, and then 2 weeks later their symptoms are back and they go back to their GI doctor. They say, well, I felt good on the antibiotics and now my symptoms are back. So then they just put them back on the antibiotics. And then it just becomes this really vicious cycle of antibiotics, feel better, symptoms come back, and it repeats. So SIBO is really just a sign that there's something else going on in the body. And that's really what we want to explore. Is there a motility issue? Is there a digestion issue? Is there a stress and nervous system piece? Are there mineral issues? Are there thyroid issues? And usually it's more than one thing because it all goes together. But with SIBO or anything else, you want to identify really what's the actual root cause so that you can actually fix it. And then where leaky gut comes in with that is the lining of the intestines is one cell thick. The technical term for that is intestinal permeability, but essentially what happens is things get in that shouldn't, and it causes the immune system to be overreactive, which is where things like food sensitivities, et cetera, can come in. And so the way that we treat the gut is, of course, we want to address the intestinal permeability and glue the gut lining back together. Things like immunoglobulins and spore-based probiotics, glutamine, et cetera. Those things can all be really helpful. But again, the question is, why do you have this? Like, what's driving this, and addressing that so that you can fully kind of wrap it in a bow and prevent it from coming back.
I agree. And a lot of times when you have SIBO, that is going to lead to leaky gut, and leaky gut can lead to SIBO and vice versa. And so I completely agree. I think it's, I tell my patients this a lot, like when you come to somebody and you have gut symptoms and or you have hormone issues, I truly believe that you can't fix hormone issues appropriately, correctly, and long term without addressing somebody's gut. That's a different topic. But, people say to me all the time, well, I don't want to do a GI map. They're expensive. Can you just give me a protocol? And it's like, you really can't, because I don't know what's wrong with you, right? Like, I mean, you can't treat them for everything, but you really need to know, like, are you digesting well? Do you have, a lot of bad bacteria? Do you have leaky gut? How is your secretory IgA? Do you have parasites? Is it a stomach acid issue? Is it an H. pylori issue? Is it a candida issue? And so it's just, that it's really hard to do that. It would be like kind of going to your doctor and saying, I don't feel good, just treat me, and not letting your doctor take any blood work, right? I mean, it's kind of the same thing. So I completely agree with all of that. It's difficult to do without knowing everything that's going on. Do you agree with the statement that sometimes, when you have leaky gut or you have SIBO or you have a lot of issues going on with your GI tract, that it is beneficial to remove foods that are more inflammatory? Not saying that you have to take them away forever, but at least remove them while you're healing your gut and then slowly add them back.
I think it really depends. So, on the GI map, we're going to see if somebody is reacting to gluten, and that can be a good just marker to look at. And then we really have to look at the other pieces. I mean, oftentimes I tell our clients, I'm like, the stress about food is going to be worse than the food itself. So if we tell somebody like you have to go on this super restrictive diet and they're just chronically stressed about what they're going to eat and exactly what they can't have and all these things, and it causes more stress, then maybe it's not worth it. So we like to approach it from an addition standpoint. So instead of just giving a list of like, you can't eat all of these foods, what I want to look at is what can we add to your diet that's going to help nourish your microbiome? So maybe we need more polyphenols, or we need more different types of fiber. We need more protein, whatever. We need more mineral rich foods. And so when we add, it takes a lot of the stress away of like, here's what I can't eat, and instead, here's what I get to have to nourish my body. So yeah, there of course are instances where people are reacting to certain foods, and it might just be helpful from a symptom standpoint. But I don't think that it needs to be this like laundry list of foods to cut out, especially if it's going to cause tons of stress.
Okay, perfect. And then you mentioned something earlier about fiber, and you said if you can tolerate fiber, it's really important. So if somebody can't tolerate fiber, if every time they eat broccoli or Brussels sprouts or anything with fiber, they have a lot of issues, then what is your solution, or what should we be addressing in that situation?
There can be a couple things. Sometimes we hear the phrase, the healthier I eat, the worse I feel. And if that's the case, typically that has more to do with the balance of bacteria in your gut. So if you've been really restricted for long periods of time, then higher fiber foods are probably not going to make you feel very good, because fiber is primarily broken down by your gut bacteria. So we as humans cannot break down fiber. And so if you have too few gut bacteria, or the good gut bacteria, then it's going to make fiber more challenging. So there's many different ways that you can approach that, but probably the easiest way is to just go slow. So instead of going from 0 to 100 and like 0 to like eating chia pudding for breakfast, I would slowly like add a tiny bit of chia seeds on top of your avocado toast or on top of your yogurt or something, and slowly working your way up. You also want to look at the form. So raw salads, probably not going to be your best option, but like really soft, well-cooked vegetables, beans, etc., are going to be great. We also like using things like sprouted beans or sprouted nuts. Those can make the breakdown and digestion a lot easier. So sometimes it's just changing the form or the amount, and then slowly working up from there.
Okay. I think that we touched on most of the stuff that I wanted to ask you. Tell everyone, before we go to our 3 questions at the end, like where they can find you, all about you, so that they know how to follow you and find you if they want.
Awesome. Well, probably the easiest place to find me is on Instagram. It's just at Dr. Heather Finley. If you're intrigued by mineral mocktails, you can DM me the word minerals, and I'll send you the guide that has all the recipes and things to get started. If you need a little afternoon pick me up or morning pick me up, I have them sectioned by like digestive health, thyroid health, sleep, etc. So you can pick which mocktail would be good for the circumstance that you have. But yeah, Instagram is a great place to connect. I'd love to hear from you and hear what stuck out.
Okay, so I like that. Minerals, and then you can get your mocktail. So I might have to get that list from you. That's awesome. So I appreciate what you do. I think it's so powerful. Gut health is that thing I think in medicine that's really overlooked. How we eat and how we sleep. Everyone's talking about nutrition from a food standpoint, and they're talking about, exercise. But I think we really miss in traditional medicine how important sleep is and how important actual digestion in your gut health is. And so, the fact that you educate people and try to help people, I love that. It's a difficult job too. I tell my patients, and I'm sure when you start doing gut protocols, they usually don't like you the first month. Like it's not a pleasant thing. And so sometimes it takes a lot of hand holding, but it's a very important job. So make sure that you guys go and check out Dr. Heather on Instagram. She puts a lot of really cool stuff up. So these are the questions I ask everyone, so don't overthink it, but what is one food that you think is the most beneficial and why? You only get to pick one. Yep.
I was gonna say like a polyphenol food. Let's go with like kiwis. Kiwis are super beneficial because they are great for constipation. Regarding our conversation earlier, they're also really high in polyphenols, which help feed your gut bacteria. So we're gonna go with that. I'm sure I'll think about something after this that I wish I would have said, but kiwis.
And do they help with digestion too? Yeah, that's what I thought. Okay, 2 kiwis a day if you have constipation. What is one thing that anyone can do that will improve their health that's completely free?
Get your eyes in the sun first thing in the morning, and that will help to regulate your circadian rhythm. It will help with your sleep. It will help with your digestion. That sunshine tells your brain it's time to be awake. It will help your gut motility. It'll help your hormones, your thyroid, everything. Go outside.
Go outside. And the last question, this is a harder one, but what is one thing you wish you would have known about your health 25 years ago that you would have done differently?
Oh man, so many things. But probably the thing that I always come back to the most is how much stress impacts digestion and overall health. I spent so many years overtraining, under eating, and doing all the quote unquote right things, but not addressing grief and stress and all the other things that were affecting my health. And it wasn't until that things shifted.
I completely agree. In medicine, any provider that's listening to this, and not even provider, any mom that's listening to this, like just the world has become such a stressful place. And I have this conversation with most women that I see that have gut health issues is like, you have no idea how much stress is actually impacting your gut. I can show you when you do a GI map, but like when you're stressed, your body cannot digest the food that you're giving it. So you're asking your body to do all these things, right? Like run your car 100 miles an hour, and yet you're giving it zero nutrition because although you think you're giving it nutrition, you're stressed. And so it's not able to actually get any of that nutrition out of what you're eating. And so it's just a really big mess. And I think after COVID, unfortunately, people have been a lot more stressed, and it's just almost like expected now. I think like that's just everyone has this baseline level of stress that they walk around with, and it's really unfortunate.
Yeah, it is. It's super unfortunate. And it is the hardest thing for most people to actually face, but it is the thing that moves the needle the most.
Well, Dr. Heather, thank you so much for coming on our podcast today. I enjoyed our conversation. Thank you for what you do and for all your time.
Thanks so much, and congrats on the book. And yeah, this was a great conversation, and yeah, I had a blast.
I hope you guys found this episode enjoyable and full of educational benefit. I had a really enjoyable time interviewing Dr. Heather. I think that she gave very good tips for people that are very doable and not necessarily costly prohibitive. I think that she's full of great information and knowledge. And I really like how she talks about, just like I do, how things like stress and just lifestyle modifications of eating slower, breathing, humming before you eat, things like that can truly change your health in a very drastic way. So if you found this episode beneficial, if you know somebody who is struggling with any of the things we talked about, with bloating, with gas, with abdominal pain and abdominal discomfort, with constipation, like most women, please send them this episode. Show them that you care. Show them that you want to help educate them by letting them listen to this episode. Also, make sure that you're following us wherever you get your podcasts. We drop a new podcast every week. Please leave us a review if you found this information to be helpful. That's how I know that I'm doing a good job. That's how I know I need to keep making this podcast. And that's how, we learn what you guys want to learn about. Make sure that you're following us on social media. Let me know what topics you want me to talk about, who you want me to interview. And lastly, please don't forget that Modern Endocrine has a license in 39 states now. So if you want to become a patient, if you're struggling with gut issues, hormone issues, thyroid issues, weight issues, or you just want to talk about longevity and being healthy and your best self for as long as possible, reach out to us. We would love and be honored and thrilled to be a part of your care team. Again, 39 states, you can do visits virtually. If you happen to live in one of those 11 states we don't have a license in, you will need to come to our state-of-the-art clinic in Oklahoma. We'd be happy to see you there once, and then we can be your provider. We are working on getting licenses in those other 11 states, though. Make sure that you tune in next Sunday for our next episode. Please have a wonderful week, and thank you for wanting to be more educated about your health. The information presented, including any materials discussed, referenced, or linked within this podcast, are for general educational purposes only, not the practice of medicine. No doctor-patient relationship is formed from you listening to this podcast or utilizing any of the information provided. I am a doctor, but I am not talking to you as your doctor. The information provided is not intended to diagnose or treat health problems or take the place of the professional medical care provided by your doctor. If you are experiencing any health problems, including problems you believe have been touched upon in any respect within this podcast, you should consult your doctor about the problems without delay. You may ask your doctor whether he or she believes the information I have provided would be helpful to you, but you should still consult your doctor immediately and follow his or her medical advice as your treating physician. I'm just here to provide you basic knowledge about the issues we discuss so you are more aware of them and can better discuss them with your doctor. That's why we call it Back to the Basics. Join me on the next episode as we continue our journey.